What's going on, everybody? Dr. Brad Whitley here, co-founder of Bespoke Treatments here in San Diego. This week, we're continuing our series on posture and back pain. Today, we're going to go through a couple things for mobility, flexibility, and soft tissue work to help with what's going on in your back and posture. So the first one I'll have you do is going to include a foam roller. So if you have one close, go ahead and grab it. And what I like to do with the foam roller is use it for thoracic extension purposes. So what we'll do is we'll come onto the ground here. I like to put it just below my shoulder blades, cradle my hands behind my neck. And from here, I'm just going to go just below my shoulder blades and then rolling all the way up to the small of my neck. So with this is your thoracic spine. I like to get into this because in most people who are doing a lot of sitting, this part of their spine doesn't move quite as well. So from here, I like to go for about 30 seconds up to a minute, nice and smooth. If you find a spot that is kind of achy, you can stay on it. And then from there, what I like to do is plop my butt down, hands stay behind the head. And then what you're going to do is you're just going to let that neck fall down to the ground. And this is going to create a little bit more of an extension moment through that mid back. It's going to feel really good for those who are sitting all day in that flexed posture. And this is a movement that a lot of people lack when they sit quite a bit. In our society today, I do a ton of sitting, so this is really good for those people who are sitting throughout the day. Same thing here, duration, I like to go for 30 seconds to a minute total, moving in and out of that. You can find a couple spots, whatever feels good. One thing to watch out here is just try not to crank through the neck. Keep that neck stabilized, let it fall to the ground. Great. So you can put that foam roller to the side. Next one we're going to go through is going to be an assisted band mobilization. So what you're going to do is you're going to have a long looped band. I'm going to use a foam pad just to support my knees. And what you're going to do here is you're going to take that looped band, you're going to loop it through your left shoulder. It's going to go behind your back, and then you're going to stomp on it with your right knee. Okay? Left shoulder, round your back to the right knee. What you're going to do is you're going to sit down, butt to heels. You're going to put that left hand behind your back. Right elbow is going to rest on the floor. And you're going to let that band pull you into thoracic rotation here. Again, this is going to be a really good movement for those who are not moving a ton throughout the day. It's going to feel really good through that lateral flank and that mid back. I like to go 5 to 10 rotations per side. I think this is a really good number, and I would do this both sides. Again, letting that band pull you into a little bit more range of motion than you would normally get just doing it without the band. Great. All right. Next, you can put that band to the side. We'll be done with that. And then finally, we'll keep that foam pad here, and we'll go through some active mobility. I like to use the half kneeling position, which is essentially one knee down, 1 foot forward. We're going to go through 2 moves for thoracic rotation and thoracic extension. First move, I'm going to have your hands go in front of you. You're going to pull that arm back, rotate to that side. Arm points to the back of the room, and then come on back. So with this, often called bow and arrow, you're going to feel a big thoracic rotation. You're going to feel a couple areas moving through that pec, through that oblique, through that hip flexor, and finally through that lateral flank. I like doing both sides, not just to that hip open side, but to that hip closed side too. You'll get a couple of different movement feelings with that. Again, duration for reps here, I would go 5 to 10 reps. Don't be quick to rush in and out of this movement. Be nice and smooth throughout that duration. Even taking a big breath in and out at that end range. Next one, I'm going to keep you in this half kneeling position. We're going to do a very similar movement and end up in the same place, but we're going to change how we get there. So arms will start in front again, and then instead of pulling back, I want your first movement to go up and then end up in that exact same position. All right? So instead of pulling back, you're going to go big reach up and open, elongate that lat underneath that armpit, and feel nice and big at that move. So open up, big, and come on back. Open up big, come on back, open up. Five repetitions on each side. Again, no need to rush through it. Feeling really good throughout that range of motion. So these are a couple of things that you can work on to help with improving posture, reducing chances of back pain. Just getting you movement is going to be beneficial for reducing that back pain and improving your posture. Stay tuned for next week. We're going to go over a couple of strength moves to help with back, posture, and keep you feeling good.